All right. Welcome, everyone. If anyone's here yet, not really sure. However, this is, I think, our fourth live now. We've had so much fun doing these live Q&As and connecting with our audience that we're making it a monthly thing. However, tonight we're down one person. Danny, if you're watching, we hope you feel better and we'll miss you tonight. But we had some really great questions come in that we wanted to address for anyone that is able to attend tonight. And before we actually do that, I also want to go live on our TikTok. So let me do that first. Carly, do you want to give a little plug to the Dizzy Reset while I do this?
Sure. Yeah. So if you have been following along with us, you may have seen in our newsletter or on some of our social media posts, we've been talking about the Dizzy Reset. So this is our 8-week group wellness program for those with chronic dizziness. And Abby and I have worked very hard to put this together. And we are live. And so we've already had our first cohort start, and it's so fun. And it has been such a journey, I think, for Abby and I in the creation of this, but it's taking all of the things that we have learned for years and years as vestibular rehab therapists and zooming out and saying, what else should I include? What else helps someone on their path to healing? So what is included in this is 8 weeks of recorded content where you get all of this, the informational videos, and you get to, and audio and all these extras to learn about how to heal yourself when you have chronic dizziness. And there are weekly group coaching calls led by Abby and myself. So we're there to talk and answer questions, and we talk about things about the program. And one of the very best parts is that we also have worked really hard to make a workbook that accompanies all of the activities. So it's not just you listening and watching videos, it's things that you engage in, because that's really how learning happens and how change happens. And so we're so excited. It's been so fun so far. Our next cohort is going to start on January 5th, and we would love to have you there. So absolutely get on our wait list. You can visit our website. There, we have a whole section, the Dizzy Reset, where you can join if you are interested, but we would love to see you there.
Perfect. Yes, I echo that. We'd love to see you there.
Mm-hmm.
Our first session is just going so well, and it's so exciting to connect with all of you in a more personal way outside of social media. So if you're interested, feel free to reach out. We offer free discovery calls if you want to see if it's a good fit for you or see if one-on-one vestibular therapy would be a good fit for you. We also provide those services. So we are now live on TikTok as well. I think I did that correctly. Let's get into some of the questions that we had submitted in advance to us. So one of the first ones that I wanted to address is something that a lot of people experience. The question is, why do I feel better in the morning and worse as the day goes on? I think generally speaking, again, this is super, super common for many reasons. When we think about symptoms, often symptoms have many influences that are contributing to them. And often it's an accumulation of factors that can put us over the edge and make symptoms either exacerbate or begin. And so when we think about in the morning, maybe we're feeling our most fresh and we haven't started the thought processes of everything that goes on in the day, and maybe our stress level is lower because we just had a good night's sleep. But as the day goes on, we're taking in a lot of visual information. We've got our cognitive wheels turning and constantly thinking, or even maybe things with memory, things that are multitasking. We have maybe some stressful events that happen throughout the day. Maybe our fatigue levels raise, and even maybe there's some overstimulation like noise. And I mentioned visual stimulation already, but noise and movement and all these things kind of compound. So by the end of the day, it makes sense then if these things add up, you can feel worse as the day goes on. One of the things that I like to teach people to do is to pace their day. So if you find that this is problematic for you, where in the morning you can do your best work and you feel like your best self, and then by the afternoon it's like everything is too much, try to take a rest break even before you get to that point of overwhelming symptoms. So we talk about zones sometimes, green, yellow, and red zones. And if you think about a traffic light system in that sense, the yellow zone is the zone where you're like, okay, symptoms are really starting to pick up. Maybe I need to pull back the reins a little bit and listen to my body. Red would be like, I probably already entered that like too much, too fast phase, and I really need to take a rest. What I mean by pacing too is it doesn't necessarily have to be lying down in bed and taking a rest that way. It could be as simple as maybe just sitting in your chair, putting your feet firmly on the floor, arms on your armrest, back against the back of the chair, and maybe you're grounding, or maybe you're implementing breath work, or maybe you are taking a brief walk. You're getting up from your computer and taking a brief walk, or doing something like cupping to give your vision a little bit of a rest. There can be quick things that you implement to prevent the symptoms from accumulating, or prevent all these factors from accumulating to then put you over your threshold and creating symptoms. This can improve. It's almost like when you work out, your bicep doesn't grow overnight. It takes many reps and many weeks to notice that muscle, that change in your muscle. It's the same thing here. If your tolerance level is, let's say, right here, it's going to take time and consistency to feel better at this level, and then at this level, and then at this level, and add more and more and more to what you can tolerate to build up your overall endurance. So I think from a perspective of getting better, give yourself some grace in the process, because you might have some days where you can do a lot more, and then some days where you're doing a lot less. But if you think about overall picture, what influences your symptoms, you can probably get to a clear understanding as to why that may happen. Do you have anything to add to that, Carly?
No, I think that was great. And I think the other thing I will say is, when you're dealing with symptoms like dizziness, that's part of your clinical picture, your brain is always trying to predict what movements are going to feel like, right? And so it starts to predict that, that might make me feel dizzy. And sort of you get into this loop a little bit where the brain's trying to predict, and then the brain's kind of always on alert mode. And that also can be draining, right? And then once you're out of fuel, symptoms are going to be a little bit louder. So it kind of all loops in together. But yeah, no, I think you covered that one really well. Oh, I lost your audio, Abby.
Oh, I had muted myself. I just want to mention for anyone on TikTok, this is a live Q&A, so feel free to comment any questions that you have about all things vestibular. We're here to support you tonight. We're also live on YouTube. We have Carly and I present tonight. You can't see Carly on TikTok, so if you want to see both of us and get the full experience, head over to YouTube. Let's jump into a live question here. We have a question that says, can you please explain the different types of dizziness?
Ooh, I would love to start this one off, Abby, and then you can tag in whenever you want. But so I think we could go in a couple different directions with this question. But I think when I think of types of dizziness, you could either think of descriptions or you can think of causes. Because dizziness itself is sort of a catch-all term, right? Someone might say, I'm dizzy, and it might mean lightheaded, right? Or it might mean I feel off balance. I have what's called disequilibrium, where I feel unsteady on my feet. It could mean that my brain feels foggy, or my head feels a little floaty, like it's not attached to my body. I feel like I have a sensation that I am rocking or swaying. There's lots of different ways that people can experience dizziness. And similarly, there are lots of causes of dizziness, right? So we have talked a lot about, if you listen to Talk Dizzy to Me, or you on our social media, BPPV, or benign paroxysmal positional vertigo. That's a mechanical cause of dizziness and vertigo, where there's a crystal in the inner ear. There are also other conditions that can impact the vestibular nerve and cause a sense of dizziness or room spinning. Sometimes people that have something like postural orthostatic tachycardia syndrome, or POTS, that can cause dizziness, but it's more from a cardiac cause. So this is how, as a physical therapist, when I'm asking questions, I'm trying to kind of this is the fun detective work, trying to figure this out a little bit and see what is going on. So I might ask questions about what makes your symptoms come on. Is it when you're moving your head? Is it just when you're standing? Is it when you're staying still, when you're exerting yourself? So there's lots of ways to kind of get answers that help guide us down particular paths.
Yeah, and I would add, to echo off that, is sometimes the descriptor is not necessarily as important as some other factors or some other characteristics of your symptoms, such as how long do your symptoms last, or when do your symptoms come on, what triggers your symptoms. And so, because people experience the term dizziness in different ways, you can ask 5 different people how to describe their dizziness, and they could all say something different. We can't necessarily use that alone to help us determine what we think the cause is and what we think the best mode of attack treatment wise would be. So instead of getting stuck on the description of dizziness, start to think more about recognizing patterns of your symptoms. Like I mentioned, when do they come on? How long do they last? What triggers them? What makes them feel better? And then the second part is, most vestibular providers, they want to know about your symptoms, of course. So they're going to ask you about your symptoms, but they usually will also ask a follow-up question. And that will be, if you say, my chief complaint here is dizziness, they'll probably ask you, can you describe your dizziness using another word or other words? Don't use the word dizzy to describe your symptoms. And again, that just helps the clinician start to determine what route they're thinking in terms of cause of symptoms, and then how to best guide their assessment and recommendations thereafter.
I love that. Yeah, our timing and triggers, so important when we're trying to decipher and decode what's happening with dizziness.
We have a clinician question here about, this one was submitted in advance. What resources did you find helpful when first starting to use video goggles or infrared goggles in practice? For me, it was more hands-on mentorship. I worked in a clinic that had multiple vestibular providers, and I was just learning the ropes and observing and looking at videos that they had collected in their clinic. But now there are so many resources online too. One would be Vestibular First website has a lot of good resources. They actually sell infrared goggles. I think I saw something, by the way, a free plug for Vestibular First, that if you wanted goggles, I think the price goes up in the new year, I'm pretty sure. So now is the time to purchase if you want those. Also, there's a website by North 49 Physical Therapy, I believe. Let me just make sure. North 49. Yes, North 49. Our friend Craig there, he's got a great online library of various videos, nystagmus videos to dissect and learn from. Also, Dan
Gold, yeah, the University of Utah has a really good collection of same thing, of a ton of different videos. And what I love about that collection is it shows sort of the expected eye movements that you would expect for someone without any pathologies. And then it shows when someone has different vestibular diagnoses, what looks different, and they'll go through a different, oculomotor screening. So it's really nice, I think, to kind of train your eye a little bit. But I have to echo, the hands-on piece is huge. And just getting your hands on the goggles themselves, practicing. We did a lot of practicing with colleagues, just practicing on each other, and then saving the videos. And what we built a sort of our own training library of, we'd record videos of our patients with their consent, of course, and everything's HIPAA compliant, but then we would store them and use those as a way to train new clinicians to do an onboarding for those goggles. So definitely, I think it's just like practice, and you want to have the hands-on sort of psychomotor skills, right? You need to practice hands-on. That's really the best way, I think.
Agreed. And also, don't be afraid. We do this all the time. If we see something unique or we're not sure, we will describe what we're seeing to another clinician via the phone or text or whatever. Describe what we're seeing and then get assistance there, because sometimes it's not always straightforward what you see when fixation is removed using the infrared goggles. Now we have another question here that I think is also a very familiar experience for people. It says, I've been told I have Meniere's, BPPV, vestibular migraine, and neck-related dizziness. Why can't doctors figure it out? I think this can be one of the most frustrating experiences, but very common, especially for people who have been experiencing symptoms for a while. I think this is multifactorial again, but for one, often there are multiple vestibular diagnoses happening at once. So people with vestibular migraine can be more apt to get BPPV, or even people with Meniere's disease can be more apt to get BPPV. So that's one thing. Conditions can exist together. People with vestibular migraine often develop 3PD as well, persistent postural perceptual dizziness. But on top of that, sometimes, I guess, zooming out and recognizing that our bodily systems are all interconnected. So different systems can be impacting our symptoms simultaneously. Just like we talked about at the beginning of this live, where you have various influences impacting symptoms, it's the same thing from a diagnostic perspective too. Let's say, for example, you have been diagnosed with vestibular migraine and you got so busy with work that day, you were in Zoom calls all day long and you forgot to eat. Well, with your blood sugar dropping, that can trigger symptoms. So maybe it's vestibular migraine, but maybe it's also low blood sugar. And you can see how different systems are connected in such a way that can impact you positively or negatively. Also, over time, symptoms can also evolve. Usually how someone feels right at the beginning of their symptoms is different than they feel, a year or 2 years or however long someone has been experiencing symptoms. And then lastly, I think it's important to note that not everyone fits into a perfect diagnostic box. And that doesn't necessarily mean that their symptoms are not real or their experience is not valid. It's just that, at least as vestibular therapists, we're often looking at, okay, how is this person functioning? So how are their symptoms impacting their ability to live life, take care of themselves, take care of others, do their job, take care of the house? And it's not always necessarily so important, although it can help determine different treatment approaches, but it's not always so important that I understand, okay, this person has this one diagnosis and it might not even impact my treatment approach necessarily, because I'm going based on how you're feeling that day, what you're telling me. So you might have gotten a diagnosis of BPPV 5 years ago, but today you might not have BPPV. You have lingering imbalance that you just can't seem to get rid of, and you're just fearful of lying flat, even though the BPPV is no longer physiologically a problem. So although it's frustrating because we tend to want to label things, I think there's good reason that symptoms like dizziness and vertigo don't always have such a clear picture. And part of it is the evolution of symptoms, the often the case where symptoms or diagnoses can overlap or coexist. And then in addition, this is a story I like to say too, is in vestibular migraine, for example, diagnostically, you have to have 5 episodes before being considered vestibular migraine. But in those 5 episodes, you had to have at least a starting episode and a second episode. So you might not have that diagnosis at that first episode, but as the patterns develop and time passes and you continue to work with your provider, then it can be more clear that vestibular migraine is the culprit of the symptoms.
Yeah. And the other thing that I'll say is that not every provider specializes in working with patients with dizziness, right? So it is not covered like, they cover in physical therapy school, they covered the basics of how to do, how to test for BPPV, but we got a little bit, but it's more of a specialty niche area. So when you think about and you're looking for providers to help you, it pays to do your research a little bit and look to see, okay, what types of patients are they treating? And it is totally fine to call the office and ask, does this person work with patients with dizziness frequently? How often? And you can get some of that information and speak with the provider, frankly, and just get a sense for, is this person going to be someone that can help me? And so There are also directories that exist to help you find at least a specialty physical therapist. I know on the neuropt.org, on Vita, there's different ways that you can find at least physical therapists that specialize in working with patients with dizziness. But I think doing your homework a little bit is going to be really, really helpful so that you can just get the best care possible.
Yeah, I agree. And there are a few sites that I want to shout out if you're looking for care. One, I had mentioned at the beginning, we do offer free discovery calls. And in those free discovery calls, if we're not a good fit for you, I will personally send you a directory or directories to help connect you. Or if I know someone in the state you're in, I will help connect you that way. But the directories are available at the ANPT website. They have a vestibular provider map that they've put together. And then the Academy of Neurologic Physical Therapy, that is the ANPT. And then also, is it Academy? I think it's Academy.
Yep, Academy.
And then also the Vestibular Disorders Association, vestibular.org. They have a provider directory at the top of their website. It says find a clinician. And then also there's something called the Dizzy Care Network that will be coming out, which is meant to help bridge the gap and help people that are experiencing symptoms find the provider that's a good fit for them. So these things can be helpful, but like Carly said, I always encourage people to do your own research, vet the provider first, because there are a lot of people that also advertise vestibular therapy, but they might just know straightforward BPPV, and that's very different than how you would treat vestibular migraine, 3PD, etc.
Yeah. Really pays to get someone who is sort of specialized. And I just saw a question pop up in the chat. Someone in Australia, do we help you over there? Absolutely, we can. So reach out to us. We are able to help patients worldwide now. And so helping connect with resources, or we do offer coaching and like wellness coaching, and can help connect you with the resources to start healing. So yes.
Yeah, not one-on-one vestibular therapy. We have to be licensed in the state that you're located in. We're licensed in, I think, 10 states now in the United States, but certainly start with a free discovery call. That's the best way to see if we're a good fit or get connected to resources to help you find your way. We do have a couple questions about medication. So one in the chat says, I have 3PD. Aside from vestibular rehab and other exercises, what medications work for 3PD? And then someone asked, how do SSRIs help with dizziness? And then I think we had one more question about medication. What are your thoughts on medication for 3PD? My doctor suggested Lexapro. So first, blanket statement, medication is outside of our scope of practice. However, medication can be part of some people's what we call treatment pie. So there's typically not one thing and one thing only that helps people with dizziness. It's usually a multifaceted approach, and it's even multidisciplinary approach. So just like I said, we as vestibular therapists, medication is outside of our scope of practice, but guess what's inside of our scope of practice? Teaching you how to function again, helping you understand the principles of neuroplasticity, being your support system in terms of education and understanding what's happening with your body. But if medication needs to be part of your treatment pie, then that might be your neurologist or your ENT or your primary care physician. So when it comes to medication, it does have its time and place, but it's rarely the end all be all when it comes to feeling better. And with that being said, I like to tell people to remember how much self-agency you have over your own healing, because medication is really something external, and typically it's meant to mask symptoms. But there's so much you can do to set your body up for success in healing if you consistently implement practices that are supportive to healing, and also practices that are really listening to what your body's communicating through your symptoms. So there are some medical doctors, neurologists, who actually won't go the route of medication at all until someone tries lifestyle modifications or lifestyle optimization strategies. So let's look at this person's sleep hygiene. Let's look at this person's relationships. Are they having social connection, or are they self-isolating? Let's look at this person's stress level. How are they managing stress? Do they have tools and a toolbox in place to help them effectively manage stress? Because we know stress can also influence symptoms. How is this person's diet? Are they nourishing their body? Are they skipping meals? What's their hydration like? What is their exercise level like? Are they sedentary, or are they getting up and moving? Um, there's so much within your control, and I think one of the biggest things is even mindset. How do you relate to your symptoms? When your symptoms come on, is it a complete like derail of your day? Or is it something that you can look at with more curiosity instead of fear? Is it something that you can look at like, what is my body trying to tell me right now? And then address it head on. And mindset is one of those things that's much easier said than done, right? We all in society, I think now with phones, right now I'm on TikTok, I'm on YouTube. I don't know which camera to look at. I've got lights in my face. Like the stimulation is so high all the time that it's often difficult for many of us to get out of a more sympathetic state, or survival mode, people call it. But a good, healthy human being would fluidly flow between sympathetic and parasympathetic states depending on what the needs are. So if I need to run because a car is coming, like I better kick into fight or flight. But if I need to settle into my evening routine and get ready for bed, I want to be winding out of that sympathetic and back into parasympathetic. So I think overall, this is biased because medication is outside of our scope, but medication does have its time and place. I just encourage people to really look at overall, what can they do that's within their control, self-agency over their well-being first, before maybe introducing something like a medication. I will also add a note that many people that we see who are on medications report such sensitivity to medication. And if you look at medication, most medication actually has dizziness as a side effect. So some things to consider, but specific medication questions, I would encourage you to speak to your doctor, your neurologist, your ENT, your primary care physician. That would be the healthcare provider to specifically ask those questions. Do you have anything to add, Carly?
Yeah. And so like when we think about physical therapist scope, like we can't provide and we can't recommend that you take or don't take medication, but what we can do is educate you about them. That's perfectly acceptable within our license. And so, so it's totally fine to ask your physical therapist if you are working with one about medications, and they are legally allowed to answer that question. But they shouldn't be telling you, you should take this or shouldn't take this. The way I approach these conversations is, if you have done all of the things, you have tried, you've optimized your sleep, you know your nutrition's good, you are modifying your lifestyle, but you still feel like your anxiety is a huge contributor to your symptoms, then it might be worth a conversation, because there are medications that we know that can treat anxiety, like an SSRI, like Lexapro, like something like that. So that's where I think the conversation has some import. If you've tried all the things and you're still not feeling like, this is the thing that's keeping my symptoms kind of coming back and causing trouble. And this is where you can have a nice conversation with your provider that you're working with, then saying, hey, I've really tried all of these different things and it's not working. The other thing that I will bring up about medications are side effects, right? So the side effects of medications, in addition to dizziness, there are other unwanted side effects that can sometimes really be problematic. So it's always a consideration to say, am I at the point now where I feel like my quality of life is being impacted, and I've tried all of the lifestyle modifications that I can? And if the answer is yes, then that's where it warrants, I think, a great conversation with your provider from there. So that's kind of how I handle that. But always, I think people always have questions about medications. Good places to look if you just want to know a little bit more about medications and what they do. There's a website called drugbank.ca. That one's pretty good to get good, because you want to make sure you're looking at good, reputable sources about what is a medication and what it does. Honestly, Google is not too bad. If you just Google a medication, most people are going to do that anyway, but you do want to make sure that what you're looking at is reputable, because it's the internet. So sometimes there are things that are maybe not quite as accurate. So yeah, that's what I'll say.
Good recommendations there. I also want to say too that sometimes medication is used as a bridge. So, for
Mhm.
example, we might see someone with BPPV, but they have really violent symptoms to the point where maybe they're even vomiting. And with that, it's very difficult to make it through a maneuver to help them because they're getting sick. So perhaps a medication that masks the symptoms or suppresses the symptoms a little bit, something like meclizine, for example, could be beneficial in that case to allow us to properly perform the treatment and get them feeling better. And I would also add that lately, some of the people that I've met in our discovery calls have been on meclizine long term. And typically, I will say that meclizine is not usually meant to be something that you use long term. It's more when people have an acute case of vertigo and they need something to take that edge off and calm the vertigo down. But then you really should be working with a vestibular therapist to try to adapt and habituate to the symptoms so that you can function without suppressing the vestibular system or without masking the symptoms. And on another note to add to that is when you're working with a physical therapist in vestibular therapy, we often we're always really using how you feel to guide our treatment. So if we don't have an accurate picture of how something is making you feel, we might overdose, meaning give you something that's too much too fast, or maybe we underdose based on how you're presenting, probably more the former. But that's another thing to consider. We want to know how what we're teaching you to do impacts you. And that can be a little bit muddied if you're taking medication every day to try to suppress symptoms.
Yeah, so great questions to ask your provider if you're considering a medication would be, what is the likely outcome expected with this medication? What are side effects I should be concerned about? And how long should I take this medication? When should I stop taking it? And just so asking lots of questions about the medication itself so you can be really well informed and know, because some medications are meant to be taken longer term, some are meant to be as needed, some are meant to be a short term. And so I think asking and making sure you get that information from either your primary care provider you're working with, or whichever provider, or the pharmacist that's prescribing the medication to you, because they can also provide that education.
Yeah. So just to tie that up with a bow, there is a time and a place for medication. It's just making sure that you work with your provider to understand if that's appropriate for you. And then also working with your provider to determine the best medication for you, because what works for you might not work for the next person, etc. Let's go to another question. I feel dizziness inside my head, like spinning, but not the room. I also have head pain above my ears and at the back of my head. How can I help myself? So, do you want to start or would you like me to start?
You start this one, then I'll jump in.
Okay. So first, I think the first step would be working with a provider. So if you are at a point where you're experiencing symptoms, but you don't know what's at the root cause of these symptoms and you're not sure where to go in terms of treatment, the first step is getting the right support team in your corner, because that can make or break your healing experience. From a diagnostic perspective, you can't really answer this question in a call like this. You need to have an evaluation where someone's understanding, okay, this person's experiencing dizziness. Is there a sinister cause to this dizziness? Do they have any slurred speech? How's their strength look? Do they have any double vision, for example? And then also you want to look at timing and triggers. So is this dizziness all the time? Does it change in intensity? Does it come and go? What triggers this dizziness? Is it caused by movement? Is it caused by positional changes? Head pain, for example, a lot of people hear the word head pain and they immediately think migraine, but actually vestibular migraine, you may or may not have head pain to receive that diagnosis. So to help yourself, I would say find a provider who knows a thing or two about dizziness and work with that provider to come to a working diagnosis as well as a treatment plan that is specific or individualized to you. Whether that is, a combination of potential diagnoses or one single diagnosis. The other thing I would say too is that many times people who have dizziness, they experience dizziness with movement. And because their brain is very smart, sometimes even subconsciously, they'll start guarding their movement to avoid triggering the dizziness. So when you start guarding movement and moving kind of robotically sometimes, or just different than what would be normal movement, you can get some neck involvement, whether it becomes stiff or painful, or maybe you do start to move because you go to physical therapy and movement is part of the treatment plan. And then you feel like your neck is not happy anymore because you were so used to just holding it still. So that's another thing to consider. It's not always when there's neck involvement or pain involved, it's not always a vestibular diagnosis at play necessarily, but it might be more movement or postural patterns that you have adapted to try to avoid provoking symptoms.
Yeah. And other things that you can do in the interim while you're waiting to maybe get connected with your provider, but zoom out and look at yourself holistically. So you want to look at, we mentioned already, some of the big contributors that can exacerbate dizziness. So looking at how is your sleep and kind of taking an inventory there, looking at your stress levels, looking at your nutrition and hydration, and looking at your general sort of mental health, looking at your daily activities that you're participating in. And this is where you can start to see, in addition to looking for what's the timing and triggers of my symptoms, are there areas that you could tweak and see the change? So maybe if you're like, actually, I am sleeping really poorly lately, see what you can do to adjust that. And because there's lots of information available about sleep hygiene, for example, you could say, all right, I'm going to try to modify a little bit. And then you can see, does this impact my symptoms at all? And that might be a way that you can start working on a few things right now that aren't specifically focused on vestibular rehab per se, but it is, looking at your overall health. And your body health is your brain health, is your vestibular system health, because your brain at the end of the day is what's putting everything together and where you're perceiving these symptoms. So, yeah.
I like that. Can we explain the difference between acute versus chronic vertigo, but I'm just going to say symptoms in general? Acute versus chronic is really about timing of symptoms. How long has this person been experiencing symptoms? So, for example, in the diagnosis of 3PD, in order for a true diagnosis to be made, the diagnostic criteria says that the dizziness should have lasted for at least 3 months. That would be more into a chronic phase. But let's say we see someone who just developed an onset of room spinning vertigo and it's there all the time, no matter what position they're in. It kind of came on out of nowhere. Maybe they felt a little bit off, but then it hit them like a ton of bricks and the world is just moving. They're so off balance. They're having a hard time walking, although they can walk. It's just very unsteady and uncomfortable. That would be an acute onset of symptoms. And we would see that type of presentation more in a hypofunction, maybe due to something like a neuritis. So some diagnoses are more chronic in the sense that they're episodic or they're experienced over time, whereas something like an acute neuritis, you can experience that neuritis, but your brain is very, very smart and can compensate over time. So even though you had that issue, your brain learns to almost act as if that issue never even occurred, as long as you rehabilitate correctly. Do you want to add anything to that, Carly?
No, I think that's exactly right. And then when we can think about acute, that also just means in like timing wise, like within, a couple of weeks or within a couple pretty immediate and something that's happening, maybe attacks of vertigo too, you could consider under acute vertigo, versus chronic is like, something that's just been in the background for a while. Because I think some of the chronic conditions, you can have exacerbations and episodes where acutely it is worse, but that still would be considered a chronic condition.
Good point. So we would see that in something like migraine, for example,
exactly.
Or Meniere's. You would have episodes of symptoms that could be an acute episode, but overall chronic condition. The word chronic sometimes makes my skin crawl a little bit because I feel like chronic has such a negative connotation. Like there's nothing I can do about this. I just have to live with it. And I was listening to a podcast once and it talked about how the word chronic is really just, hey, we don't have all the answers to tell everyone with this problem, this is what you need to do to get better. Like this, take this, do this one thing and this will get you better. That's where the word chronic comes from. It doesn't mean that there is nothing you can do about it. It doesn't mean that there's no self-agency over your well-being and health. So the word chronic, I wish there was a more positive spin to it, because even if you have a chronic condition, there are a lot of people in this world that live well with a diagnosis of vestibular migraine or with a diagnosis of 3PD. We have some success stories in our podcast episodes as well, but also on social media, there are some great people to follow who have done the work. And it's not to say that you might not have another bad day or experience symptoms again. It's just to say that you have the tools and the understanding and you're able to listen to your body and give your body what it needs. Yeah. Anything to add to that thought?
Yeah. No, I love that. Well, I was to say ongoing. How about ongoing instead of chronic? Just ongoing. It's not completely resolved yet, but there's lots of things you can do. And, my bias as someone who treats a lot of people with chronic vertigo, there's so many things that we can do to make it better and get you doing all the things you want to be doing. So, yeah.
Good. I feel like we've hit all the questions that we've had. I don't think I missed any. Do you see any that maybe we should touch on?
Well, I just see one more comment that popped up in the chat saying that this person, 3 little bits, has been in balance therapy for a week and it's helping a lot. And understanding the explanation of how things work is really helpful. Absolutely. So this is why, this is why I think you need to go back to, like, if you remember when you were a younger kid, and I have 2 little kids, which is why this is very real to me right now. I get asked why a lot. And when I give good explanations, it actually makes a difference. But I absolutely feel like as a provider, it's my job to explain what's going on, because if you don't know what's going on, why are you going to want to do any of the exercises that I'm suggesting? So absolutely ask your providers why. How is this going to help me? What does this do? And getting the why, so huge to impact motivation. And it just makes you feel better that when you're like, oh, I know what's going on now inside my body. I have the words to explain this now. So I love that comment. Thank you for sharing.
And also, it's a principle of neuroplasticity. When things become meaningful to you, your brain learns and adapts better. So if you understand why your therapist is asking you to walk down the hall and turn your head every couple of steps, if they give you a real world example of that, it makes more sense as to why you do it. And then also, I like to tell people, when you understand the principles of neuroplasticity and also the foundations of vestibular rehab, you can start to get repetitions in outside of just doing the exercises themselves. Yeah. All of a sudden, maybe you're cooking in the kitchen and you're going between the sink and the fridge and you're looking first with your head in your eyes, and then you're coming back. You're dissociating your head from your body instead of moving robotically or unblock. And you're every time you do that, you're reinforcing that neural pathway that says, I can move my head and not be dizzy. So when you start to understand the explanations, it's almost like life becomes your vestibular therapy. And the more reps that you have, really the better in terms of neuroplasticity, especially when you're consistent with it.
Yeah, I love that. We had a question just pop up, Abby, that I think you'll love answering this one. Can 3PD develop on its own, or is it usually triggered by another underlying condition or event?
So 3PD requires an underlying condition or event, but that event doesn't necessarily have to be vestibular in nature. It could be something that the person experiences similar types of symptoms, but not necessarily the exact symptoms that they develop when they develop 3PD. So I think that's important to know. Not everyone that I've talked to that 3PD is suspected, they don't always pinpoint something specific though, truly. Some people can. They're like, you know what? I rolled over in bed. The the whole world spun. I haven't been the same since. I was told it was BPPV. My BPPV is better. I still feel like this. Why? Well, probably because it's transformed into 3PD. The BPPV was the trigger, but now it's 3PD. So yes, technically from a diagnostic standpoint, there should be some sort of triggering event, but it doesn't necessarily have to be a vestibular event to be considered 3PD. Do you agree with that?
Yeah.
Also, there's a comment there. The difference between dizziness and lightheadedness is significant. So we were talking earlier about the descriptor of symptoms being less significant sometimes than the timing of symptoms and the trigger of symptoms. But you're absolutely right. If a patient tells me, if a person tells me, every time I get up from bed, I feel like I'm going to pass. I feel like I'm going to pass out. I might be thinking, oh, I need to check this person's blood pressure for sure. Mm-hmm. Whereas if someone said, every time I get up out of bed, the whole world spins, I just feel so disoriented. I'm like, ooh, I need to check this person for BPPV for sure. So yes, the way that you describe symptoms does matter, but also the timing and the triggers of those descriptors is important. Yeah, the explanations recruit my own mind and body in the healing. Love that. I love how you just wrote that. I think I might use that. Me explaining this is to recruit your own mind and body in the healing process. If there's nothing else, which I don't see anything on the TikTok end, but if there's nothing else, I think we can wrap up. Oh, maybe one more. Is there any value in walking on the ground versus walking on a treadmill for helping neural connections?
I love that question. I think it depends on what you're trying to do. So I both have excellent merit, and from a priming the brain for neuroplasticity, aerobic exercise is great. So whether you're walking outside and getting your heart rate up a little bit, or you're on a treadmill and doing that, you are priming your brain to create these great neural connections, because it causes release of some of these brain chemicals that can strengthen synapses, which are those connections between your neurons. So it absolutely can do that either way, just by getting the physical activity. But if you think about, if I want to get better at, if I want to improve my balance, for example, when I'm walking outside on uneven ground, then you need to practice what you're trying to improve, right? So specificity matters with neuroplasticity. So practicing what you want to get improved will help with those specific neural connections. Or if you want to improve walking with head turns, you could do that on either. You could do that on the treadmill, or you could do it over ground. So I think it depends on what you're trying to do in terms of which neural connections do you want to make stronger.
And I would add too, sometimes walking on a treadmill might be what's available when you go to see your vestibular therapist, but walking on a treadmill in a closed environment while facing a wall, let's say, is very different than walking on the street in New York City.
Exactly.
So that's what Carly's saying. It depends on the goal. And sometimes maybe it requires a little bit of both, depending on what the goal is and what's available to you and what's tolerable at that time. Cool.
Awesome. These are great questions. Thank you,
Yeah,
for sending these in. I love this.
It's really fun.
Yeah.
Everyone, we're going to wrap up this live Q&A, but we will be scheduling one for January. We'll be sending out a list or a link so that you can submit your questions ahead of time. And then we'll also send out the link to join us here. Hopefully Danny will be back in January, and we hope to see you all then. We wish you all happy holidays, a happy new year, and see you in 2026. I can't even believe I'm saying that.
Can't believe it, but we'll see you then. Thanks, folks.
Bye-bye.